Hi guys, welcome back to another one of my videos. Today I will be talking about pneumonia. Pneumonia is an infection that results from a cold or flu that was not treated at all or that was either not treated correctly how it should have been treated. There are multiple symptoms and signs that can indicate pneumonia, cold, or flu. There's high fever and shaking chills, chest pain when breathing, nausea, vomiting, and diarrhea, coughing up phlegms, and having shortness of breath. Those are all symptoms for all three of them, but the main sign that may indicate pneumonia will be suddenly feeling worse after having the flu or catching a cold. Most of us, whenever we catch a cold or we have the flu, we drink medication, and 3 to 4 days after, we will start feeling better with the medication. But if you suddenly feel worse after having the flu or catching a cold, that may be a big indicator to check yourself for pneumonia. There's tests for diagnosis. There's chest x-rays, blood tests, and sputum tests. The chest x-rays help doctors visualize if there is any inflammation in either one or both of the lungs. The blood tests are used to determine if there are any bacterial infection in the blood. The sputum test, which is also known as the spit test, will check the spit to check for any bacterial in the spit. The blood test and the sputum test usually check for the same thing. They're although used for different purposes or people. The blood test will be used for those adults and those teenagers. The spit test will be used for infants and children that do not like having their blood drawn. For treatments, there's only antibiotics and medications. Pneumonia can be treated with antibiotics, and if it is a virus pneumonia, doctors may prescribe antiviral medications. If it is a bacterial pneumonia, it will be prescribed with antibacterial medications. There's a few facts for pneumonia. One of them is the influenza, or known as the flu, is the most common cause that leads to pneumonia. The flu is usually what it starts to be until it progresses and starts being pneumonia. If the flu is not taken care of and it's just left ignored, thinking it will pass by on its own, it will become worse. It will get infected. It will not end good at all. Pneumonia can make you land in the hospital with serious problems. I say this because my father ended up in the hospital because of pneumonia. He was on antibiotics, he was on fluids, he was on medications, but because he thought that he had just had the flu, he did not drink medications, he did not take care of himself while he had the flu, and he thought, well, it's going to pass on its own. It sure did not, and he ended up in the hospital. Another fact is that pneumonia can affect people of all ages. Mostly during the infant years of the kids, most parents will just let the first few days of them kids being sick pass by. They will give them ibuprofen, morphine, medications at home, but that sometimes increases the risk of pneumonia if you don't take your children to the hospital and have them actually be checked by a doctor. By the time they get to the doctor, most of the kids are already so much more worse than how they started. So please do not underestimate the power of the flu. Smoking cigarettes or excessive use of alcohol also increases your risk of pneumonia. Of course, this will only be for the adults. There are no children, no infants, no kids smoking or using alcohol. But having lifestyle habits can help you beat pneumonia or make you a higher risk for a bad experience. The more healthy life you live, the stronger your immune system will be. Starting with kids, the sooner you start, the better. Here are my citations, and thank you for watching my video, and please stay tuned for another one. Goodbye!